What is inflammatory bowel disease? Well, inflammatory bowel disease, IBD, is a chronic disease for which there is currently no cure. It is a group of conditions that involve chronic inflammation of your digestive tract. And like many chronic diseases, IBD can alternate between very significant episodes, what we call flares, and stretches of time with milder symptoms or no symptoms at all, what we call disease remission. Often it can be painful, affect growth in children, and at times lead to serious complications. The two main forms you will hear about is ulcerative colitis, UC, and Crohn's disease, CD. For Crohn's disease, it may often develop very gradually, or alternatively appear quite suddenly, and can occur anywhere along the digestive tract from the mouth to the rectum, what we call gum to bum, although it usually affects the lower part of the small intestine and the colon. Ulcerative colitis, UC, typically affects only the most inner lining of the rectum and large intestine, also called the colon, starting in the rectum and extending continuously for variable stretches through the large intestine. What's very important is understanding the benefits and the risk of the treatment of this chronic disease. Inflammatory bowel disease is typically treated with a series of medications. Your treatment plan will revolve around medications designed to reduce intestinal inflammation, control your symptoms, and hopefully prevent long-term damage from inflammation. The good news is when you have the proper treatment, you can expect to enjoy improved physical health, higher quality of life, less abdominal pain, less fatigue, and less depression and anxiety. Unfortunately, there's no clear roadmap of how your IBD will progress over time. Everyone is different. You experience peaks and valleys of symptoms over the years. And so to make the right decision about your treatment, you need to balance the benefits and risk of treatment against the risk of no treatment. All medications have benefits, risk, and side effects. It is vital for you to understand that not treating this disease is more dangerous than the side effects of the medications. When you get the right treatment for your stage of disease, situation, lifestyle, the benefits of treatment far outweigh the potential risk. Most people living with inflammatory bowel disease will lead fulfilling lives despite the challenges of the illness. And treatment can help you maximize your health. It does so by reducing complications, reducing the number and frequency of flares, minimizing hospitalizations and surgeries, improving healing of your intestine, enabling longer periods of remission, and providing a better quality of life. Finding the best medicine and consistently following the recommended treatment can help you control your disease. And when you achieve your best health, you increase your opportunities to develop physically, intellectually, emotionally, and socially. Flares. The word flare refers to symptoms you experience when your disease is active, causing tissue to become inflamed and irritated. The most common symptoms are abdominal pain, bloody diarrhea, but can also include weight loss, fatigue, fever, achy joints, skin and mouth sores, and inflamed eyes. Complications are additional symptoms or conditions that you may experience as a result of living with this chronic disease. When you have IBD, you may experience inflammation of other organs, and that includes the eyes, skin or joints, liver or bile ducts. Complications such as anemia, malnutrition, osteoporosis, bowel obstruction, ulcers, fistulas, and anal fissures, and very rarely colon cancer. In children, they can have delayed growth or sexual development. Healing. When you have IBD, the interior layer of tissue lining your intestine, called the mucosa, gets damaged. Mucosal healing is the restoration of healthy mucosa. Mucosal healing is the target of all the treatments that are out there for inflammatory bowel disease. Another challenge of living with IBD is the development of abnormal connections between your intestine and other organs. These are called fistulas, and hopefully proper medication will reduce the likelihood of developing these fistulas. Surgery. Having surgery and spending time in hospital can be worrisome for anyone, so it is better to avoid these events unless absolutely necessary. Surgery is generally accompanied by pain and muscle loss and puts you at risk of a reaction to anesthesia, bleeding, blood clots, heart attacks, and strokes. This is the reason why your healthcare provider will suggest medical treatment in order to reduce your risk of surgery, as the time you spend in hospital for surgery will put you at risk of infection and disrupt personal relationships, work, and school. Adherence. What is adherence? Well, IBD is a chronic disease, and medication should always be taken as prescribed, even when you are feeling well. Again, the goal of treatment is to heal your mucosa. In other words, restore your mucosa to being healthy. And therefore, you should continue your treatments even when you are feeling well. Researchers and doctors will use the term adherence or compliance to describe how well patients follow their treatment plan. This includes taking medications at the proper time, taking all of the medication, refilling prescriptions, and going to appointments for infusion or injections regularly as scheduled. 5-aminosalicylic acid, also called 5-ASAs, also known as mesalamine, reduces inflammation in the intestine, controls diarrhea, and helps to maintain long-term remission. These are oral medications. Sometimes they're used alone, or sometimes they're used in combination with immunosuppressants and steroids. The goal of 5-ASA therapy is to help you achieve and maintain remission if you have mild to moderate ulcerative colitis. This is a very safe category of medications and has a very low risk of intolerance and allergic reactions. Your healthcare provider will discuss with you these very low risks before starting this group of medications. Steroids. Steroids rapidly reduce inflammation by suppressing the activity of immune cells. The most common steroids used to treat IBD circulate throughout the whole body. Some newer steroids target specific areas of the intestine and tend to have fewer side effects and less toxicity. It is very important for you to understand that steroids are meant to only be a short-term therapy to control acute flares and to achieve remission. They are not used to maintain remission. Steroids can be taken with your usual maintenance medications. This often means you will begin your treatment with a maintenance drug while still on steroids. Once your symptoms improve, your doctor will carefully and gradually wean you off the steroid if that is appropriate. Depending on the exact location of the disease and how significant your symptoms are, these steroids can be delivered orally, rectally, or intravenously. We do have certain suggestions for you to follow when using steroids. Consider wearing a medical alert bracelet or necklace with the steroid name engraved. Ensure you get your blood pressure checked regularly while you're on steroids, and your healthcare provider will tell you if they're worried about your blood sugar and will need you to get it checked at least once while on the steroids. It is very important that you also do not stop taking steroids on your own. Most of the time, it is important to slowly wean your body from these drugs under direction of your healthcare provider. The main risk of steroids is infection. High-dose steroid therapy increases the risk of developing infections. Because of the high risk of infections, steroids, again, are only used for short periods of time. There are also other common adverse effects of steroids. These will include acne, swelling of the face, osteoporosis with long-term use, glaucoma with long-term use, high blood pressure, eye cataracts with long-term use, and easy skin bruising. Immunosuppressants are drugs that suppress the immune system, thus reducing inflammation and preventing the body from mistakenly attacking its own digestive system. Immunosuppressants aim to decrease the use of steroids and maintain remission for patients with moderate to severe disease. They have fewer and less side effects than steroids, so they are used for longer periods of time. However, because they can take several months to achieve their full effect, they often are combined with steroids in the beginning. You can also use them with other medications to prevent your disease from flaring while you're taping off the steroids. Commonly used immunosuppressants are azathioprine, also called Imuran, 6-mercaptopurine is another name for it, and methotrexate. Immunosuppressants can be taken orally, and methotrexate can be taken orally or by injection. Again, as they suppress the immune system, the risk of infection is anywhere from very low to medium risk. And this really depends on your general baseline health. And again, these medications will be prescribed under the supervision of a healthcare provider so that they can individualize to you your actual risk of these medications. Of note, these medications can also be associated with a very low risk of cancers. And again, this risk is still extremely low. The cancers that they have been associated with are non-melanoma skin cancers. And again, it is very important to talk to your healthcare provider about your own individual risk because everyone will have a slightly different absolute risk depending on other risk factors they may have, for example, for skin cancer. Please alert your healthcare provider, however, if you experience any of the following side effects while on this medication: yellowing of the skin or whites of eyes, dark urine or blood in your urine and stool, chest pain or stomach pain, fever or flu-like symptoms, shortness of breath, or loss of appetite. The reason why we do use this class of medications is that there is research to show that they will decrease the incidence of flares. Biologics and biosimilars. Biologics are proteins specifically engineered to block one or more inflammatory pathways in your body and thus reduce the inflammation that causes your IBD. A biosimilar drug has demonstrated to be highly similar to a biologic originator drug that's already been authorized for sale, known as the reference biologic drug. Biosimilars, you may have heard, were previously known in Canada as subsequent entry biologics, or SEBs. Health Canada only approves biosimilars for marketing in Canada when the manufacturer demonstrates that their product is of similar quality, safety, and efficacy to the original reference drug. One class of these biologics blocks the action of a protein called tumor necrosis factor, alpha TNF, which your body makes naturally. If you have IBD, you produce more of this protein, causing inflammation and damage to healthy tissue. By suppressing TNF alpha production, anti-TNF biologics reduces inflammation and damage to your intestinal tract. Biologic therapy aims to induce and maintain remission for patients with moderate to severe disease. More importantly, they are the only class of medications that has been shown in randomized controlled trials to achieve mucosal healing. Sometimes biologics are used in combination with other inflammatory bowel disease medicines to achieve better treatment effect or reduce the risk of developing antibodies against the biologic. Biologics are delivered in one of two ways: through intravenous, by a healthcare provider at a clinic, or by subcutaneous injection, which you can do yourself at home or have done by a trained nurse at your home or in a clinic. The risk of biologics. there is a very low risk of serious infection. Biologics in general are considered the safest treatment option in terms of infection in comparison to immunosuppressants and systemic steroids. It is very rare to have an allergic reaction to biologics, and it is not high in biologics compared to other non-biologic medications. If the allergic reaction happens during your infusion, these reactions are actually very easily managed at the time of the infusion and often managed by slowing the infusion rate or temporarily stopping the infusion until the reaction stops. In terms of cancer risk, again, individuals using a biologic have a very low absolute risk of developing a cancer. It has been estimated that the risk of cancer related to biologic use is no higher than 6 out of 100,000. However, as I said before, your individual risk may vary depending on your own risk factors and your family history. And again, it's very important to have the conversation with your healthcare provider about your individual risk. Other very low risk side effects would include bruising or bleeding, difficulty breathing or shortness of breath, tingling, numbness or weakness in the arms or legs, visual problems, yellowing of the skin or whites of eyes, dark brown urine, fever that does not go away, swelling of the ankles and feet, unexpected sudden weight gain, and chest pain. Again, these are rare, but please contact your healthcare provider immediately if these rare side effects were to happen. The benefit of biologics is, again, they're the only class of drugs that have been shown in randomized control trials to heal the mucosa. Among people taking biologics for IBD, it is generally accepted that fewer than 1 in 5 will have a disease flare within the first year of treatment, and that up to 40 to 70% of patients who start off with moderate to severe disease will have a clinical response. And it is also estimated that up to 17 to 40% of patients who start with moderate to severe disease will go into clinical remission. Unfortunately, stopping the biologic therapies may lead to disease relapse and flares in most patients, as again, there's no cure for inflammatory bowel disease. So the majority of the time, your healthcare provider will recommend taking these drugs on a long-term basis. Biologics can also protect you from complications after surgery. After surgery, it may be that you need to be on a biologic to prevent the next surgery. Again, biologics reduces inflammation and tissue damage in the GI tract. Overall, we also know that IBD patients who take biologics have significantly lower hospitalization and surgical rates than those who do not use biologics. IBD patients taking biologics experience greater mucosal healing and longer periods of remission than those who do not use biologics. A fistula is an abnormal connection between your intestine and other organs. When patients develop fistulas, we know that they are very difficult to heal. The good news is up to 50% of IBD patients taking biologics may heal their fistulas, compared to only 13% of those who do not use biologics. We also know that patients who take biologics have been shown to experience improvement in their quality of life. They report having less abdominal pain, greater quality of life, improved physical health, significantly less depression, and less fatigue. JAK inhibitors, or Janus kinase inhibitors, are a new oral treatment option for adult patients with moderate to severe ulcerative colitis that helps to achieve and maintain remission. JAK inhibitors are small molecules in a pill form that interferes with a number of key pro-inflammatory cytokines involved in the origination and development of inflammatory bowel disease. In contrast, all of the other agents that we have been talking about, called biologics, are delivered through injectables, or intravenous agents. Xeljanz is the first JAK inhibitor approved by Health Canada. It provides a new option for individuals with UC and helps promote mucosal healing in the gastrointestinal tract. When you have IBD, the interior layer of tissue lining your intestine, called the mucosa, gets damaged. Mucosal healing is the restoration to a healthy mucosa. JAK inhibitors help to promote mucosal healing in the gastrointestinal tract. In general, use of Xeljanz in combination with other therapies such as biologics or immunosuppressants such as azathioprine and cyclosporine is not recommended. Similar to biologics, the main risk of JAK inhibitors is the risk of infection. The most commonly reported infection is shingles. Similar to the other medications we have talked about, with any new medication, there is always the low risk of developing an allergic reaction. Similar to biologic therapies, there is a very low absolute risk of developing non-melanoma skin cancers that may be associated with using advanced therapies such as JAK inhibitors. And again, this depends on your background risk of developing cancers. And again, you should look to your healthcare provider in being able to give you the proper counseling to tell you what your own individual risk is. Benefits of JAK inhibitors include increased healing and longer periods of remission. JAK inhibitors help to promote mucosal healing in the gastrointestinal tract and have been associated with improved quality of life. As well, JAK inhibitors are taken orally, which means you can easily and conveniently do that at home or at work. Until we find a cure for inflammatory bowel disease, you will expect to have IBD for the rest of your life. But current treatment options help control the disease and minimize your symptoms so that the majority of patients enjoy a healthy and fulfilling life. The good news is, although we have not found the cure of this disease, we are constantly looking at new treatments to optimize efficacy, improve quality of life, reduce complications, and reduce risk of being on that medication for patients. Most importantly, by understanding all your medical options and their associated benefits and potential risk, you, along with your healthcare provider, make the best decisions about your health. To get the most out of your treatment, follow the plan you and your doctor have discussed and agreed upon as being the best for you, your condition, your situation, and lifestyle. It is really important that you be involved in decisions about your treatment. If you don't understand something or you read something that is not in keeping with what you just heard from your healthcare provider, then please don't be afraid to ask questions. If you find your drug regimen difficult to follow or wish to try out a different type of treatment, please speak to your healthcare provider and do not change or stop the treatment without doing so. If cost is a barrier, often there are multiple solutions that you may not be aware of. So again, speak to your healthcare provider. For your treatment to be successful, become a partner with your healthcare provider team, deciding on a treatment plan together, asking questions, and asking for more information, and letting your healthcare provider team know how things are going at every step of the way.